I think we achieved what we set out for. The kind of sessions we had, the speakers we had, they represent all stakeholders. So it's industry, it's government, it's clinicians. So far, I think everyone is very happy about the way the deliberations have proceeded. Every challenge in healthcare is an opportunity for technology. So be it rural urban divide, be it chronic diseases, be it absence of doctors. So any issue you throw to technology, it will solve it. So I think we need to be more open-minded to deploy technology across the continuum of care. Industry is ready to give solutions. See, there are two things to look at it. There is a technical maturity that the industry has, and there is an organizational maturity that the stakeholders lack. So for every challenge, you have a solution which is technical. You have multiple solutions for every challenge. But I think organizationally we are not mature enough to adopt it. So you need human resources to bridge this divide of organizational and technical maturity. But I think we are all ready. Just the time has come. See, we are all very lucky to have a Prime Minister who has made a couple of initiatives as his personal, he's put his personality behind it, he's put personal stakes behind it. One of them is Swachh Bharat, other is Beti Padhao, Beti Bachao, and same is Digital India. So I think if the top level has a push and they have a buy-in, the rest will fall in place. So I'm quite optimistic that we'll achieve the goals we have set out for Digital India, and health will be impacted. Honestly, if you ask me, I'll upset many doctors. So the future of health lies in technology, not with doctors. Let's accept it. It would be fair to say if doctors don't embrace technology, they'll be left behind. See, it's all clinical. I mean, healthcare is all clinical, all scientific. So technology can definitely be married to all the clinical evidence and give out decision support systems. So if doctors don't embrace it, the patient will directly use technology, and that's the time when probably doctors might become obsolete. It's a harsh statement to make, but let's be very frank to accept this is the only sector which has not been touched by technology so far big time. The rest all consumer facing sectors have been touched, be it retail, be it agriculture, be it finance. Health is the next frontier, and the future lies in the hands of technology. So far, I think all the entities working in technology have not been able to gather clinical evidence. The moment they get clinical evidence for supporting the deployment of IT, I think this market will explode. See, the vision for healthcare is not the right thing to talk without understanding the dynamics in India. So if you want to make health for all and all for health free to everyone, practically not going to work because of the financial constraints we have. But if we start giving health for all for the below poverty line, free of cost, I think that makes a lot of sense. Co-pay for middle class and let the rich people pay for the healthcare. So I think then we will have health for all really. Otherwise, we'll keep struggling with just making statements. I think media has a big role. So I would always say, like, you change the way people thought about politics, you change the way people thought about society, change the way people think about healthcare. Without awareness, there is no demand generation, it's all supply driven healthcare. To make it real demand generation healthcare, media has to play a proactive role. I think more lies with you than with us.